I enter into the room. It is a clinical stations. I am giving a smile, introducing myself, giving my mark sheet to the examiner. So examiner give the command, do the general examination of the child. So I wash my hand. I introducing the child. Suppose Ali. Ali is an 13 years age old boy, and with mother. Mother suppose Aliyah. So I wash my hand, introducing myself. Hello, good morning. I'm Dr. Emma, one of the candidate today. So Ali, how are you? How is your health, and which class you are studying, and how old are you? So 2-3 question I'm asking. I actually checking her mentality, maybe submental or maybe normal. And I find that on inspections the child has large tongue, and visible hemihypertrophy, lateralized overgrowth. What I noticing, child is obese, tall, and there is no device attached, no any distress. So these are the unusual features I'm noticing. So child is obese, I understand. Then I go on the neck. Neck, there is no any swelling like thyroid. Then I'm telling, please remove your shoes and the socks. I sit, I look at the child legs. So legs, definitely I'm finding hemihypertrophy. Then I'm going for back. Back, there is nothing I find. The child is obese, that I understand. Back, anything I check. Then I'm showing him Byton score doing, but Byton score is also negative. Then I'm checking the gait. Can you please walk? So he walking and come back. Then measurement, I'm taking the height and weight. I tell you that I want to plot on the centiles, BMI centiles later. Then I'm going to the examination. First of all, I'm noticing the hand. The child is obese, so hand. I'm seeing any extra finger, extra digit for Bardet-Biedl syndrome, but nothing I find. Symmetry I'm checking. I'm telling him to do like that, so he doing the symmetry. There is asymmetry I find. One hand is smaller than the other hand, and the squatting, I'm telling, can you do this with me? So squatting he can do or not. Okay. These three I do, and then I do the check the pulse, head circumference, and then eye, and also the hearing device, anything attached, eyeglasses, anything. Then the mouth, he will be open the mouth. Tongue, I'm seeing macroglossia and also any high-axis palate present or not. I go the abdomen, I auscultate the heart and also the chest, and the abdomen just palpating by manual palpations because of Wilms tumor, associated with the Beckwith-Wiedman syndrome. I find on the ear there is ear creases, I find, and also any hemangioma can be present on the forehead, the facial nervous, I find. So putting together, I think it is a case of Beckwith-Wiedman syndrome. I'm present my case today. Get the opportunity to examine Ali. He is a 13 years age old boy. He may be well communicating with me throughout the examinations. What I find, there is hemangioma. I find macroglossia. I find hemihypertrophy, and he is tall and obese. Though I have to plot an appropriate BMI chart. I find this, and I find ear creases. I find ear creases. I find. And also in umbilical hernia, maybe scar mark I find, removal of omphalocylogastrophysis, operation marks in the umbilicus I find. Scar marks I will tell, or what I find I will tell this. So putting together, I think it is a case of an obese child with Beckwith-Wiedman syndrome. So how can I would like to complete my examination, full developmental assessment. I want to see that hypoglycemia affect his development or not. And this is. I would like to ask the mother about the birth weight and any difficulty in liver, and also birth hypoglycemia, neonatal hypoglycemia. This management, first of all, I will take the history. I will revise the note. I will see what investigation already done for these children. First of all, it is a clinical diagnosis. I do the genetic testing. I do for obesity the liver function test, insulin, random blood sugar, liver lipid profile. These are I will do. I will do the echo, obstructive sleep apnea, sleep study. Then we will do the tumor marker, because we know tumor marker have tumor present. Abdominal ultrasound. We do the MRI of the abdomen. These are we are doing. What are the common tumor associated with Beckwith-Wiedman syndrome? Easy to remember. Wuhan, that is Wilms tumor, adenocortical carcinoma, hepatoblastoma, neuroblastoma. Okay. Okay, Wuhan, that is, yes, hepatoblastoma, neuroblastoma. These are the common. How can I manage? Management is first of all the ABCD, airway, breathing, circulation and dehydration status maintain. So according to my finding, if need oxygen, I will give the oxygen. Bedside random blood sugar and blood pressure I will check. And management purpose, if macroglossia, abdominal wall defect, surgical management. If child has any abnormal movement, neonatal hypoglycemia they present, antiepileptic drug, neurologist, endocrinologist involved, multidisciplinary team involved, oncologist. If any tumors we find, oncologist involved. These are the management actually. So Beckwith wiedman syndrome. What history in Beckwith? If it is comes on a video station, the history I would like to ask, like his delivery, is there any birth weight, macrosomic baby, delivery, any difficult delivery, any abdominal wall defect, mother has any diabetes. These are, I'm telling the major and minor criteria of Beckwith wiedman syndrome. Major criteria are, first of all, macroglossia, macrosomia, and abdominal wall defect. Minor are hemihypertrophy, ear creases, facial hemangioma, facial nervous flames, okay, ear creases, and hypoglycemia. So these are the 4 features in total 7. 3 are major and 4 are minor features. Thank you.